Alright, let's learn things. So we are 20 cards deep in a seemingly never-ending ocean, and as always, we're going to attempt to take another bucketful out of infinity. I think that's a good analogy. Stay tuned for flashcards 21 through 30. Alright guys, so welcome back, and as I said, we'll be reviewing flashcards 21 through 30. So let's get it started with question 21. Name in order the 6 treatments used to treat asthma and COPD. Hint: 5 are drugs. Alright guys, so the first thing that you're going to do for your asthma and COPD patients is get them started on nebulized albuterol and Atrovent. The albuterol and Atrovent are delivered together in a nebulizer. The albuterol at a dose of 2.5 milligrams and the Atrovent at a dose of 0.5 milligrams. The third thing that you can do for asthma and COPD is use your CPAP. CPAP stands for continuous positive airway pressure. Number 4 is an IM injection of epinephrine. For adults, it's going to be 0.3 milligrams of a 1 in 1,000 concentration. Pediatric patients get half the adult dose at 0.15 milligrams of a 1 in 1,000 concentration. The fifth thing that you can give is an IV steroid such as salumedrol. And for severe bronchospasm, you can give 2 grams of magnesium sulfate over a period of 10 minutes. Question 22. The criteria needed to diagnose LVH, or left ventricular hypertrophy, on an ECG is blank. In order to diagnose left ventricular hypertrophy on an ECG, you need to first take a look at leads V1 and V2. Out of leads V1 and V2, you're going to take the deepest S wave, measuring it in millimeters. Next, you're going to take a look at leads V5 and V6. Here, you're going to take the tallest R wave, again measuring it in millimeters. If the sum of the S wave and R wave is greater than 35 millimeters, it qualifies for LVH. Alright, moving on to question 3. Treat congestive heart failure with Lasix at a dose of blank milligrams, or twice the patient's daily dose to a max of blank milligrams. So your standard dose of Lasix or furosemide is going to be 40 milligrams. But if the patient already takes Lasix, you're going to use a higher dose. The dose that you deliver is twice the patient's daily dose to a maximum of 100 milligrams. Question 24. During pregnancy, resting heart rate will increase blank beats per minute. Pregnancy often increases resting heart rate by 20 beats per minute. Moving on to question 25. Use a blank or blank gauge needle for a needle cricothyrotomy. So when performing a needle cricothyrotomy, you're going to use either a 16 or 14 gauge needle. Question 26. If adenosine does not work in treating a stable, narrow complex tachycardia, then try either a blank 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 or a blank blank. So adenosine is going to be used to treat SVT, but if adenosine doesn't work, then you can try a calcium channel blocker, such as Diazepam, or a beta blocker, like metoprolol. Question 27. Which leads do you look at to determine axis deviation? So in determining axis deviation, you're going to look in leads 1 and AVF. Question 28. What is your adult diazepam dose for treating delirium tremors? So delirium tremors from alcohol withdrawal are going to be treated with diazepam at a dose of 10 milligrams IV. Question 29. After flushing an IO with 10 milliliters of normal saline, consider blank at a dose of blank before beginning the infusion. Hint: same as the Lasix dose. So after flushing and establishing an IO, you're going to consider using lidocaine at a dose of 40 milligrams given slowly. This is going to help decrease the pain associated with getting an intraosseous infusion. And question 30. Blank and blank should be withheld from patients who show either ST depression or elevation in lead V4R until med control is contacted. So when a patient presents with ST depression or elevation in lead V4R, then you're going to want to withhold nitroglycerin and morphine. This is because both nitroglycerin and morphine are notorious for dropping the patient's blood pressure, as is having a right side ventricular infarction. Elevation or depression in V4R is indicative of an infarction or ischemia. So that wraps up part 1 of episode 3. Part 2, with the more in-depth review, is going to be linked here sometime around this time next week. And so I'm going to try to release a new part every week, but expect some variances in this, as a lot of this is still quite new to me. And don't forget that every like and subscription helps me and this channel substantially. And with that being said, I'll see you guys next time, and take care.